Welcome to Absolute Talks. Today I'm joined by a clinician who needs no introduction, Dr. Maurice Salama. Dr. Salama is here hosting a full arch master's course here at the lab, and I thought I'd grab you for a quick interview.
Yep.
Maybe talk about your new training facility down in Miami and a little bit about where you think we are in the industry with full arch all-on-X applications.
Absolutely. First of all, thank you, Conrad, for inviting me. The facility here was really outstanding, really beautiful group of people, full course for this one today, and it was really great because this is an arena in dentistry that needs a lot of attention because you can't learn it without being educated over time. It's not a one and done thing, and I think the commitment of the lab to educate their dentists that they work with is really something to be commended, and I just wanted to thank you for that. I think the future of this arena is very important because with what I believe is great power comes great responsibility, and I think as a profession we owe it to our patients and really our society not to arbitrarily remove teeth and large amounts of bone and soft tissue when it's not necessary. So being educated, understanding when to do these procedures, how much to remove, and doing it guided, planning the cases out with technicians that can help and assess the amount of restorative space needed, I think is really, really critical because we really want to minimize the damage we do, the morbidity of these cases, and maximize the effectiveness. And I'm hoping that through training, through guiding them as you do and being able to plan these cases in 3D and doing them fully guided will minimize those types of situations.
And I think you agree FP1 is the future, or at least FP1, FP2 instead of these FP3 large structures we used to do.
Yes, I think what's happened is we've taken patients that really should have been treated FP1, FP2, which is, for those out there who don't know, is treating it as a conventional case without artificial gingiva. And I think what's happened is people have really taken patients that should have been treated minimally invasively, that should have been an FP1 case, and through massive amounts of unnecessary bone reduction, they end up with artificial gingiva and with an FP3 prosthesis that probably was unnecessary in some instances.
And do you agree that there's always been a lot of talk about hygiene, especially on the upper arch, that people don't want to do these hybrids because of convex? But that had a lot to do with bone reduction as well, don't you agree?
100%. I think the more that we're taking away, the more difficult it is for the patient to actually cleanse. Also, the lab. Some labs aren't well trained, the technicians aren't well trained, the design team isn't well trained, and they're creating phalanges on these restorations which are uncleansable. But as much as we may rely on the design work, the technician, in the end, it's the doctor's responsibility to direct the lab and direct where the amount of bone is going to be reduced and how much to reduce and what's the design of the prosthesis. What we discussed today in the course was about empowering the dentists to not relegate and delegate these responsibilities beyond the scope of what is intended, which is the dentist is the final responsible party.
And then you recently started a new training facility down in Florida, if you want to give a shout out to that.
Yeah, I'm very, very excited. You know, I've been doing this for about 30 years, as you know too well. We've had a chance of working together.
Yeah, hope I get an invite back to
Yeah. You know, we lectured together, and you've lectured for Dental XP in New York and the symposiums. And now, for the first time in 30 years, I decided I moved down to Florida, and I decided to work with a great group of people, Lester and Ruben Jim and their group in Homestead near Miami, and we opened up the Salama Training Center, and I'm really, really excited about it. We started our first mastership program this year. It's 6 core courses that are taken over a year's time. All the courses are 2 days with a hands-on component that's very rigorous. So we're not just lecturing, we're training, doing hands-on, having them feel and touch, and doing all facets of the implant process. So it's an implant fellowship program that goes through extraction management, bone management, soft tissue management, sinus, posterior maxilla management, and then of course the restorative phase, the prosthetic phase, and the all-on-X full arch phases. So we're excited. We had a sold-out first year, so we're already in the process of planning out the 2023-2024 calendar. And we just released our elective courses, which are not part of the core curriculum. So those are now available for those interested to come to Miami. It's 25 minutes from the airport. We'd love to see you. It's a beautiful facility, state of the art. It's a fun time to be down in South Florida, as you all know. It's always good in Miami, a lot of fun there. But we do great training programs, very intimate. You can find us at www.salamatraining.com. And if you're coming, you're not just learning from myself. It's an inclusive center that has brought on some really talented educators and clinicians and surgeons and prosthodontists and laboratory technicians to teach you every facet of these procedures in depth with a hands-on component in each and every one of them. So I'm hoping they'll continue their education, because education, and that's what they call it, continuing education, right?
Amen. From me, congratulations on an amazing career.
Thank
and always willing to share. I remember the first time you invited me down to speak with you, how impressed I was when you said we have to be cautious how much bone we remove. I think it's such a good philosophy. Thank you for joining me.
Thank you so
Safe
much.
travels
Appreciate
home,
it.
and we'll talk soon.
Take care.